Hey everybody, so since I couldn't do my presentation in class, I'm doing it today in this YouTube video. And I'm a nursing major, so mine is going to be based on how microbiology can be used in the nursing field. So, here we go, we'll just get started. Okay, so to begin, there's so many different ways that micro is crucial to being a nurse. And one of those ways is aseptic technique in all the ways that we learned on Top Hat and Labster, and especially in class with wiping down surfaces with disinfectant spray, sinks, counter spaces, examination tables, especially in a doctor's office or in a hospital. And I know whenever you go to the doctor, they'll take your temperature, and then they'll pop off the little thermometer cover, because that way they can use the same probe for everybody without having contamination happen because of these covers. And then obviously needles, vials, tubes, syringes, and they all go in the biohazard bin. And then hand washing, new gloves whenever you see different patients so you don't cross-contaminate, and cleaning of different equipment, such as different probes, like an ultrasound tech or a nurse that is doing some kind of examination that would involve Hey guys, sorry, I got a phone call in between slides and it messed up the video. But this is just a really good diagram that I found showing kind of how the collection of the blood sample goes, and then how it's stored, and then how it is tested. They do a blood smear and they put it on a glass slide, just like the ones that we used in class, and they stain them. And then that way it shows you all these different little cells within your blood after about 5 minutes after it's been stained and everything. And then under the microscope, that's when a doctor or a nurse would be able to examine it and say, oh, this is what this is, and these white blood cells should not be, there shouldn't be this many of these, or, you know, just any irregularities or anything like that. And so here is just an example of all the different stuff that comes out whenever you get a CBC blood test done. So this is for your white blood cell count, red blood cell count, and then hematocrit levels, hemoglobin, and then just some other different stuff. And then the differential part, it actually examines the all of the different components of your leukocytes, which is your white blood cells, and it tells you the different levels of those, because, you know, a lot of disorders, you'll find that there's a high number of white blood cells, you know, surrounding that area of infection, or, you know, just within the blood in general where something is, you know, not right. And with this, it can kind of tell you more about what the problem may be, like if you have too high of this or too high of that. So like, for example, you know, this is what that neutrophil level is, and then that's showing anemia there. This is what a good blood smear would look like after the after this diagram that I just showed you. And then this one shows how an irregular neutrophil looks, and I just found that interesting that it showed those things specifically within a differential. But I do know that doctors have to order a CBC blood test with differential if you want to get this information as well. And then this is just kind of what the scale of like a vitamin D deficiency looks like. So like a mild to moderate deficiency is 25 to 80 nanomoles per liter, and I think my levels were around half of 25, so it was probably about, I mean, it was less than 12, I remember that. But yeah, they just get a vial of blood just like that, and then they do that. So I found that interesting in terms of how much can be shown through microbiology just with a tiny little vial of blood, and how it can be seen too, just like we learned in class with the stains. And then just different examples of how cultures can be used to diagnose and treat illness. Throat swabs, I found, had really high statistics within the tasks that nurses use every day. So one of the things I found is, stuff like gram staining and there was one, and it was like a skin scraping test, and those were in like the smaller levels. So earlier when I showed you the stuff with the irregular leukocytes, I said this probably isn't being done in that many hospitals, like to me, but it might be done in one like St. Jude or something like that, because they have the labs and the equipment to examine things like that. But yeah, so back to this. Throat swabs and cultures were in the higher statistics compared to, the lower ones, like gram staining and all that stuff. That's not normally being done in a lab very often, but this was. And urine samples, as well as blood cultures, they were the highest used ones, and those were the areas that they found the most infection in too. I found that interesting. So throat swabs, you can get a variety of different things done through a throat swab. One of them being a rapid strep test. I'm sure everybody who's watching this has heard of the rapid tests for COVID, and the fact that they might not be as reliable as one that would take a few more days to get results from. And that is because those rapid tests, they're testing positive or negative based on whether the antigens that fight the bacterial infection are there or not. And if it's not being cultured long enough, then you might get a false negative and actually end up having something like that. But COVID's not really a good example of this, because COVID is a virus and this is a bacterial infection. But so yeah, rapid strep, that was just an example of like a real life application of a rapid test. So you start out with the throat swab, and then there's a diagram on the next page that I can show you, and you added an antigen and a reagent, and you put it in the little machine, and it takes a few minutes to show up, and it'll tell you whether you have Streptococcus pyogenes, and like within that culture. I'm talking about that one, silly. This test right here will tell you whether you have Streptococcus pyogenes in your blood culture. And so yeah, that was the main difference between a rapid test and a throat culture, which takes longer. It'll take like a day or two, and it can actually tell you what kind of strain you have of Streptococcus pyogenes, and what antibiotic would be best to treat it. So yeah, that's the main difference. Throat cultures take longer, and they're actually showing the growth of it on a nutrient agar plate. Not a nutrient agar plate, but in a petri dish. Whereas this is just testing for the antigens that fight against that bacterial infection. So I found that interesting, because I didn't know that about rapid tests as well as I understand it now. And so this is just kind of an example of what like a healthy mouth would look like, not having strep, and then, different things like that, because a lot of doctors that do the rapid test, they also just do an examination of the mouth too. And so these are some of the things that they would be looking for, like redness of the throat, white spots, swollen tonsils. And this was a good diagram I found for the rapid strep test. It shows you like doing the reagent and waiting and all that stuff, and then it'll tell you whether it's positive or negative. And then I saw this really good swab. This is what the blood, this is what the culture looks like for that throat swab for strep A. This is what it looks like on a plate. And this is what it looked like under a microscope. And I was really fascinated because of all the different cells that I saw in it. Like, it wasn't just the Kochi cells. I don't know how to pronounce it. But, yeah, so that's what that looks like on blood agar and in the mouth, and then what the test looks like. And then that's another picture of strep, but just the Kochi cells. And so yeah. And then I saw this and I was like, yes, I have to use that. And so this is just an example of like the different group of strep and the zone of inhibition based off of the antibiotic that was used. And so this is another reason that it's good to have a throat culture done as opposed to a rapid test, because whoever might have had like this one obviously probably did not have the best results compared to this one. So yeah. And then to finish things up, there's some treatments that would not be possible as a nurse without microbiology. One of them is, one of them that has really been a key influence in this class is antibiotics and the act of administering them. It's like penicillin, azithromycin, amoxicillin, and a bunch of other antibiotics are recommended by nurses and then prescribed by doctors every day to help with bacterial infections. And they can be used to treat all kinds of stuff like sinus infections, ear infections, strep throat, obviously, and other bacterial infections that are pretty common like that. And then also vaccines, we've seen that from birth. Like, for example, I was vaccinated against chickenpox, tetanus, Hep B, all those things when I was born, whereas someone like my mom, the chickenpox vaccine was not around yet. So she ended up getting chickenpox as a child. And so now she has to get the shingles vaccine. But and then I used the example earlier of someone who was getting treated for leukemia, or was getting tested for leukemia, and I didn't want to get that confused as a bacterial infection. I just wanted to show how that staining and how that looked under a microscope compared to what we've learned in class, and how some nurses might use it. But yes, I didn't want to get that confused because this is microbiology. And then in streptococcal pharyngitis, which is the formal term for strep throat, there's a multitude of antibiotics that can be prescribed to treat it, depending on a person's medical history, allergies, whatever preference the doctor has for prescribing. I know there's plenty of nurses or nurse practitioners that will be like, well, I'll give you this, but I don't normally do this because of this, and things like that. And then I put this little part in there because I'm actually allergic to penicillin, and I have a tendency to get bacterial infections, such as strep throat and sinus infections. And so what my doctors do is, instead of prescribing me an antibiotic that's like in the psyllin family, like amoxicillin or penicillin, they prescribe me antibiotics that are in the mycin family. And so like a Z-Pak, that the formal name of it is azithromycin, and that's what I always get prescribed when I have a sinus infection or strep throat. And then there's also clindamycin and clarithromycin, and they work similarly, but they work differently because they're narrow spectrum antibiotics, and so they know a little bit more what to look for. But yeah, that's all. And then there's my sources. Thanks guys for watching. Had a good few weeks with all y'all. Bye.